is in Nguyen Tây Bắc, that is Northwest Vietnamese News, the longest running Vietnamese language newspaper in our region. Go to nvnorthwest.com.
Hi, I'm Mac McGregor, the host of the You Can Make a Difference show, which airs live every Friday at 12 noon PT time. On the You Can Make a Difference show, we shine a spotlight on people who are doing amazing things to make a positive difference in our communities and in our world. We talk about what inspired them to do the work and what inspires them to keep going, how they got their start, and how you can, if it inspires you, plug into their work. We can all do something that makes a difference. So tune in every Friday at noon to the You Can Make a Difference show with Mac McGregor.
Connect to your Seattle at Pier 62 with free events and programs all summer long. Family-friendly activities like music, art, dance, yoga, storytelling, fitness classes, and much more. All free for you to enjoy. Visit waterfrontparkseattle.org for the full summer schedule. That's waterfrontparkseattle.org. Connect to your Seattle at Pier 62.
No, you can't get enough of Rainier Avenue Radio.
The Rainier Avenue Radio App. It's me, your host, Tony B. Joining me will be Dr. Mark Del Beccaro, and we're going to, of course, talk about the coronavirus, specifically the Delta variant. Right now, I'm actually in Oregon, where the governor has just required the mask mandate be reinstated. So once again, everyone in Oregon is wearing masks. Will that be something that's happening in Washington soon? Actually, on my way down to California, where they've been struggling with COVID as well. In Washington, well, we did reach the 70% vaccinated level that our governor wanted. But now there is this thing called the Delta variant. We're going to talk about the Delta variant, other variants, and just pretty much just call it everything you wanted to know about the Delta variant. We'll get into some other issues as well. I'd like to welcome to the program Dr. Mark Del Beccaro. Mark, did I say your name correctly?
You did. Thanks very much for having me, and feel free to say Dr. Mark. It's quicker and easier.
All right, Dr. Mark. Well, you have a number of different titles: Communicable Diseases Program Manager, Assistant Chief. Is that right? Is that one of the titles that you have?
Yeah, I think they call it Deputy Assistant Chief or Assistant Deputy Chief or something.
Okay. Well, let's start by this. I'm not driving, by the way. I am a passenger. But Mark, I wanted to make sure that I did this interview with you because these are questions that I have, and I'm sure a lot of folks have, as we've been hearing about the Delta variant. But let's start with this. Let's just give us some information on your background.
Sure.
Yeah, let's just start with that. Where'd you come?
Well, I started working for Seattle King County Public Health last June, so over a year ago. Worked first for 6 months setting up all the testing sites in South King County with a group of folks, and we set up over 6 sites in South King County, which, as you and many of your listeners probably know, is the area most heavily impacted by COVID due to health disparities and other economic disparities. And as it's been all along, including in the recent surge, the number of cases and the positivity of the tests is 2 to 4 times higher in the South County than in North Seattle or North King or East King County. So did that, and then starting in December, helped set up the strategy and operations for our high volume vaccine sites, as well as some other work related to vaccines.
Well, again, Mark, thanks for the work that you do. Before we get into this new, I'm calling it another strain, a variant is what it is, of COVID-19, what were you charged with initially back in March and I'm taking it back here, 2020, when this all first happened. Were you aware of the potential that we would still be where we are today? What was going through your mind, Mark? March 2020.
So in March of 2020, I had not yet joined public health. I was actually finishing my career at Seattle Children's, so I was still there. But I have known and worked with Dr. Duchin and others in public health. So as I saw it coming, clearly realized that this was going to be a unfortunate, hopefully once in a lifetime thing, and that's part of what brought me over to public health to help with this. So I started in June of 2020.
All right. Communicable diseases. What is your educational background? Usually when I'm talking with someone in this particular instance, they're a virologist or, and again, excuse me for not remembering all of these particular oldest terms that there are. But you say that when this happened, you felt like this would be a place where you needed to be. Give us a little bit about your educational background and what made you feel as though, hey, I can probably be of some help during what I see potentially coming down the road because of my background.
Sure. My clinical background is I'm a pediatric emergency medicine provider, and so I've been on the front lines through flu and other surges that have happened in over the years, as well as I have done a lot of studies looking at the incidence of disease and healthcare systems response, and served on a bunch of state and national panels around infectious disease issues and how to mobilize healthcare systems to respond to them.
And as I'm sure you know, there is an extra push right now to get folks vaccinated. Folks have their reasons for not getting vaccinated. Unfortunately, Dr. Mark, I'm sure that you know this has also become a political football. So here we go.
Yeah.
I'll start with this. To your knowledge, is the Delta variant something that was man-made, a form of the coronavirus, again, that is being used for whatever purposes to get people to get the shot in their arm for any type of disease warfare? Is it? I'll start with that, and I think that you know why,
Sure.
because people are having questions. Right. So in that regard, do you know about the Delta variant in that regard?
Sure. I have not seen anything in the scientific literature that supports that. You know, I understand people have a lot of different theories about things, but viruses other than COVID mutate all the time. That's just part of what they do. Every germ does that. And it's not unusual. And we all suspected that over time, whether it would take months or years, that this virus would also go through changes. Every year, the flu virus strains change a little bit, and that's why you get a flu shot every year, to get you to have a shot that's most effective against the variants that are circulating then. So this is not unexpected. And again, there's no evidence that this was done on purpose by anybody.
Okay. And well, why is it called the Delta variant?
You know, you caught me on that one. I didn't go back to look at how they come up with the naming nomenclature. Kind of like hurricanes, they have different naming conventions. But what it means is that there's enough of a change in some of the way the genes of the virus express their proteins that it's enough different from the other strains that they gave it a new letter designation of Delta.
Okay, so Delta has no clinical explanation. It is just a term that used to describe this particular variant of COVID-19. Is that correct?
Well, it does have different protein. It does have some different. The genes express different proteins So what it is that it has just enough differences in the proteins and the way it interacts with the proteins of our immune system that they adopted the new naming convention and called it Delta. So it is a somewhat different virus, but it's not a completely new, different family of viruses. It'd sort of be like, different people in the same family have different hair colors, but they're still the same family.
We heard about the effectiveness of the Pfizer, the Moderna, the Johnson & Johnson against COVID-19. Are those statistics the same for the Delta variant, the efficacy of those particular vaccines?
There's still data being accumulated to really get to the bottom line of that. There is probably going to be some differences between them. Right now, I don't think we have enough to say for sure which one's the most affected, or conversely, which one is least effective. What we do know is that they're all substantially more effective than no vaccine. So the people that are getting really sick or dying are overwhelmingly people who are not vaccinated. So regardless of the vaccine type, they do have an effect on reducing your risk of getting infected, getting seriously ill, or dying. There's no question about that. All of them.
Do we not have enough information to determine whether, I think that they said at one point, I don't remember which one, so I'm just guessing here, was like 92% effective. We don't know yet if those numbers are the same, less, more, specifically for the Delta variant of COVID-19.
Well, we do have some evidence that the CDC and the Vaccine Council is looking at that may suggest that a single dose of Johnson & Johnson may not be quite as effective, but there's other data that shows that it was. So I think we're still waiting to get more studies and more people analyzed in these infections of people. Remembering that because the overwhelming majority of people who get vaccinated don't get sick, it's not that there's a lot of data out there yet to say for sure. The studies are sometimes a little conflicting in their percentages.
You're listening to Rainier Avenue Radio. It's me, Tony B. My guest is Dr. Mark Del Beccaro. We're talking about, of course, the coronavirus and the Delta variant and some of the issues surrounding the coronavirus and the Delta variant. Let's get directly into this now. These things called variants, you say they are mutations and they happen even with the flu. How does that happen?
Well, by just sort of the natural selection of the way genes are, when you replicate, or one virus grows a new virus and replicates itself, it will have some differences in the gene. Just like, when a family, if you look at a family over time, nobody in a family looks exactly alike. And sometimes, just by chance, one of those variations in the way a gene is expressed leads to it being more successful in reproducing. And so, especially in communities or countries where there's low vaccination rates, if the virus is allowed to reproduce thousands and thousands of times, you're just going to get more chances for some random mutation to cause it to be the strongest one in terms of how fast it can create new viruses, and that's how it spreads faster than other ones.
With this particular variant, the Delta variant, it's been described as more communicable and also more contagious. Can you explain to us how that happened, Dr. Mark?
Well, there's some evidence that, for one thing, that it reproduces itself faster, so there's twice as much of it in a shorter period of time, like in your nose and in your respiratory system, so that you can spread it that way. There's also some evidence that some of the proteins on it may be a little bit better able to evade your body's immune response when it gets in. It's not for sure that that's the reason, but it certainly seems to be true that it does replicate or grow and reproduce faster than the other ones. So if you got, let's say, I got exposed today and 2 days from now we measured the number of viruses, it does appear that the Delta virus creates more copies of itself in a shorter period of time, which then makes it more infectious.
Okay. Again, my guest is Dr. Mark Del Beccaro. We're talking about the Delta variant. And you're right here on Rainier Avenue Radio World. Again, this is part of our coronavirus impacts on Seattle and surrounding communities. Here we are. It's August of 2021, and we're looking at something that we didn't think would happen before. Maybe again, this is something that the scientists knew about. And as we are now dealing with COVID-19 and all of the different ways it impacts and affects everything from childcare to our economy, there is the potential that this new strain can cause some new damage. And we're having this conversation again. It's everything that you need to know, everything that you wanted to know about the Delta variant. So, Mark, what do we know so far in regards to the Delta variant and its ability to, I'm going to call it sustain. And what I mean by that is initially we heard that this thing was airborne. We heard that the 6 feet of social distancing. We also knew that it could last on objects. And so with the Delta variant, is everything the same, or is it also something again that if it's on something, it could live longer?
I don't think we know enough about it living longer. What we do know, back to what I was saying before, is that it creates a lot more copies of itself quicker. So you have more of it to spread around. And that's why even though I'm fully immunized and I could get it in my nose and I wouldn't know it, that's why we're asking people to wear masks, because the primary way that it's spread is when you cough or sneeze or talk loudly and the air comes out of your nose and mouth with the viruses. And if you're wearing a mask, they're all going to get trapped in that mesh of an effective filter on your mask. And so the biggest issue is really trying to keep it from getting out away from your face. And, if you're outside and it's not very crowded and it's a windy day, it's going to just get blown around the air and there won't be very many viruses. So your chance of getting one is not very high. But if, like, I was sitting in your car with you and we both didn't have a mask on, the air would quickly get saturated from our breathing and talking with all these viruses coming out of our nose and mouth. And again, what makes the Delta seem to be the problem is it makes more copies of itself. So if you thought about all these little specks of viruses coming out every time you coughed or breathed or sneezed, they soon would saturate the air. And then you would breathe them in and get it.
Dr. Mark, what is the type of immunity that COVID-19, for those who have had COVID-19 but not the Delta variant, what type of immunity does your body just naturally build up to prevent the Delta variant? Or if you've had COVID-19, are you still susceptible to getting the Delta variant of the same COVID-19?
Sure, and I'll answer that in two parts. For one, if you've had the vaccine, it does slow down the number of copies, so that what I was talking about, the amount of virus that you're making. And it does also, your immune system does attack the virus much better than somebody that wasn't immunized. So what is really clear and what we have really good data on is that if you're vaccinated, your chance of getting sick, especially dangerously sick, is way lower. It's 10, 20, some studies show even 30 times less likely than somebody who's not vaccinated. If you had only an infection and not vaccinated, we also have data now from a number of different places that show that just having had the infection is not as good as having the infection and getting immunized. So if you had the infection and you get immunized, you will get a really high boost of the antibodies that will attack the virus. So we know that a lot of people think, oh, I had COVID, I now have natural immunity, but unfortunately it doesn't work as well as we would hope. And we strongly urge, because we have this data that shows that those people still get sick, that they get immunized.
Do we have information yet? Again, it's turned into a little political football, but youth aren't vaccinated. Do we have information about how the Delta variant impacts our youth who cannot yet be vaccinated? Is it any different from COVID-19? Is it more severe? Do our youth have some sort of special antibodies because of their age that will prevent this from happening to them? How does the Delta variant, with the science that we have so far, impact our youth who can't get vaccinated, at least as of now?
Great question, Tony. So, there's a lot of thought that early on that kids would not get as sick as adults if they got COVID. And to some extent, that's true. If you just look at numbers of people, certainly very, very elderly population were the ones that were most likely to die if they got COVID. But what we're finding nationally and in all the children's hospitals now is that they're starting to get filled up in their ICUs with otherwise healthy kids who are getting COVID. And they are one of the groups at risk. So one of the things that I and public health feel as adults is we have a responsibility to protect those that don't have normal immune systems, or like kids who are not able to get vaccinated yet. So while their risk might be less than an older person or somebody with a chronic disease, it's not nothing. And we are seeing quite a few children now who are getting hospitalized and in the ICUs with COVID. And when you take that into account, it's all the more reason why mask wearing is important, because anybody's chance of getting sick or seriously sick will go down if there's less viruses in the air that they're breathing.
And Mark, I'm talking specifically about the Delta variant, because that is the one right now that is causing all of the different surges. But there are other variants as well. Can you give us some background specifically related to COVID? Is this something like 3 or 4? Is it in the dozens? Is it in the hundreds? Is it just something that happens repetitiously?
Well, two parts to that, and let me know if I answer it, Tony. One is, in our state, about 90% of the variants are the Delta variant. And the others that we're seeing right now are not particularly worrisome either in their number or what they're doing. Now, I would expect that may change in a few months, that, we might possibly see another variant other than Delta emerge, but that's hard to know. But it's certainly within possibility. The Delta variant, we're not really sure that it causes worse disease. We just know that it is more infectious, so there are more people getting it, and because of that, there are more people sick with it. Not because of the number that gets sick, they're getting sicker. I don't know if I said that in a way that made sense, but more people can get sick with Delta because it's so easily transmitted. Therefore, you're going to see more people in hospitals with Delta than maybe in the past, not because it's a worse, more lethal strain.
Dr. Mark, I guess the only way that I can explain this is the Delta variant. Is it COVID-19 trying to say, I'm going to live, I'm going to survive, you're not going to be able to get rid of me? I know that may be a very simple way of putting it, but I guess the question is, why does this happen? How does this happen? Is it just saying, I'm going to figure out how to continue to be a problem in society. That's what I do as a virus. Is that what's going on?
Yeah, that's true for all living things. They all learn to try to adapt to, it's sort of that statement you probably heard, survival of the fittest. So every gene mutation that makes you more able to reproduce and create more copies of yourself will be the one that gets selected. So if a virus mutates, but it's not effective and we kill it off easy or it doesn't spread, then it won't create copies of itself that propagate. So even by just random chance of a mutation, if it turns out that it can spread faster, it will do that. And that happens in all living things, not just viruses. So it's just the fact of biology.
Dr. Mark, I remember a time when polio was a problem. We got a vaccination about that. You don't hear about polio
Right.
As often anymore. With the variants on COVID-19, and again, I'm not trying to turn this into a political football, but if folks take the vaccine, does that increase the potential of eliminating COVID-19 and all of its variants? Is there anything that we can do to stop the variants, to stop the mutations, to slow down Delta so that we won't be in this constant phase of, well, here's another version of it, here's another version of it. I mentioned today as I'm driving through Oregon that the governor reinstated the mask mandate. And so at the end of the day, what's going to be the best way for us to get rid of this thing?
It's a great question, Tony. And there are some differences in the type of virus that polio was versus this that made it possible to eradicate it. But the other is part of what you were also alluding to. My parents grew up where there were polio epidemics and people's houses were sealed and they weren't allowed to come out and public parks were closed. And so when the polio vaccine came out, myself included, we all lined up to get the vaccine, and there was a great public agreement that that's what should happen. And so the virus didn't have anywhere to go, didn't have anywhere to mutate and cause new strains. Now, these viruses, like the flu, are a little bit different. I do think that, there may be I think it's conceivable that in the future, just like we get annual flu shots, we may move towards a time where we have to get annual COVID shots because they're slightly different strains. But I think the risk of hospitalization and death and what we're living in now will only go down if all of us really look at this as it's all of us together working as a community to eradicate it. And King County is one of the highest vaccinated counties in the entire country, but we still have well over 100,000 people that haven't been vaccinated. So that virus has plenty of people to pass around in.
I'm not a doctor. The longer this thing lives, will that make it more difficult to eradicate?
Well, the more it's around and the more people it can be around in, the more chance it can mutate into new forms that we will have a hard time eradicating. If we magically got, 95% of the people to get immunized, then the places for it to mutate and to move around the community would go way down significantly.
Dr. Mark, thank you, first of all, for joining me on such short notice to share this information with everybody. We're getting hit with a lot of information from everywhere. As I mentioned again, people are looking at more mask mandates. I want to give you the opportunity for final words here because I've been firing these questions at you.
Oh, sure.
But I'd like you to just share whatever messaging, whatever information you'd like to share right now to our audience.
And Tony, thanks for having me and thanks for doing this. It's a great service to the community. I know people are tired of masks and I know they're tired of this, but the only way that we're going to get back together to, somewhat of our normal lives is to get people vaccinated and to wear masks for now until that happens. And remember, everybody that gets sick is somebody's sister, brother, mother, dad, grandma, grandpa, or friend. And we don't want to be the one that passes the virus to somebody else. So until we get this under control, the best thing you can do to protect yourself and your family and friends is to get vaccinated and wear a mask. 2 things.
Dr. Mark, I appreciate your time. Thanks again to Public Health, King County, Seattle, for making this happen. We're going to have more information on the coronavirus coming up for you. And again, I'm on my way down to California. And so
be safe. Watch out for all the fires and smoke.
and I can tell you one of the reasons I'm driving was to avoid airplanes and that particular hassle that may cause with these variants. So again, thanks, Dr. Mark. Hopefully we can get you back on and maybe just talk about variants in general.
Sure.
To give people a broader perspective, but I did want to hyper focus this time on the Delta variant. You've been listening to Rainier Avenue Radio World. It's me, Tony B. Our special impacts of the coronavirus on South Seattle and surrounding communities. And that title is significant, South Seattle and surrounding communities. Initially, the thought was we weren't getting information in South Seattle, and quickly we realized that folks weren't getting information who were in the same position all around, and we realized that if it's happening in Seattle, it's happening in Vancouver, Washington, it's happening in Spokane, it's happening in Everett, and due to the isolation, everyone wasn't aware. So we're just trying to do our part to make sure that in protecting our community, if we get information that can help those who may live in less diverse communities or may not be receiving information because they don't trust the resource there, that we're here. We'll be back with more information on the coronavirus right after this.